Okay, so let's get started. So today's session is for fellows. We're going to talk about how to give how to give feedback to the learners, to your learners. So learning objectives is the discuss the challenge in teaching communication skills, and explain the role of a teacher in learning communication skills. And also, we would like to show you an example of a hot seat role play. So, this is the lines from Atul Gawande's essay, Letting Go. He wrote like this: I said that it had not been possible to remove all the disease, but I found myself almost immediately minimizing what I'd said. We'll bring in an oncologist. I hasten to add, chemotherapy can be very effective in these situations. She absorbed the news in silence, looking down at a blanket drawn over her mutinous body. Then she looked up at me. Am I going to die? I flinched. No, I said, of course not. So this is to, emphasize that even the, prestigious surgeon like Atul Gawande struggles with communicating bad news. So, does better communication really make difference? Yes, it does. Good communication improves patient adjustment to illness, lessens the pain and the physical symptoms, increasing the adherence to treatment, results in a higher satisfaction with care, and less stress, less burnout, fewer malpractice claims. So it's beneficial for the physicians too. On the other hand, poor communication, increased use of inefficient treatments, and higher rates of conflict, and less adherence. So yes, definitely, it helps. It makes a difference. So, many people say, okay, understand communication is important, but you can just call palliative care. They are very good. Yes, we are very good. But I think I showed you this slide before. Can you call palliative care for all the consult? It's not that easy. We have one cardiologist for the 71 patients with heart attack. We have, in the United States, we have one oncologist for 140 patients with cancer. But one palliative care physician, meaning that trained specialist palliative care physician, like you guys, you have to cover 1,200 patients with life-threatening illness. It's impossible. I know you guys are hardworking, but it's impossible for you to take care of these patients. And then in order to fill this gap, we have to create the 6,000 to 18,000 PC physicians trained with fellowship. It's impossible. I think in the United States, every year we create, I think, 200 to 300 palliative care physicians through the fellowship. So it's practically impossible. So palliative care physicians will never be enough. So, we call this, basic primary palliative care versus specialty palliative care. Primary palliative care, basic symptom management, and basic discussion. This has to be taken care by all clinicians. We call primary palliative care. And if things get complicated, the specialists like us get called refractory symptoms or more difficult conversations. Otherwise, we cannot sustain. Otherwise, the patients cannot get the palliative care in the most appropriate way. So can clinicians really learn to communicate? So basically, we have to, as a palliative care specialist, our job is not only take care of, not only practice palliative care on our own. I mean, that's the minimum. By specialists, I think we are expected to teach our colleagues, non-PC clinicians, your nurses or non-PC clinicians, or in terms of, in the institution, wherever you go. That's what is expected to you guys. So can clinicians really learn to communicate? I hear, you pick up what you need from experience. I have been doing this for 20 years. So I'm very good at that. Some people are simply better than others. You cannot teach communication. I don't believe this. These all, to me, it's like BS. Everybody can speak English, so good or bad, you can finish the conversation, but that does not guarantee the quality of the conversation. I use the, cooking analogy. I can make pasta, but my pasta is not good. You don't want to eat it. So being able to finish something does not guarantee the quality. And also, the problem is you don't see how others communicate. As a fellow, you don't see other fellows communicate. You can see that you are attending how attending communicates, but once you become attending, you cannot see how other people communicate. So it's kind of difficult for you to know if you are good or you are not so good. And no emphasis on training. Traditionally, the training from communication has not been so emphasized. So communication requires skills, and you can learn them. So, this year we have been teaching you about these skills. Ask, make invitation, address emotion with no statement or with statement, and make the use silence, or answer questions simply, make a recommendation rather than asking yes no questions. These are all communication skills, and you are learning that now. But these are a lot. So how do you learn those? Whenever think about one procedure, let's say like central line placement. Like Gianna, you're a surgeon, so you have a lot of skills to learn as a surgeon. So when you learn one skill, I think we have to go through like four steps. When you're a medical student, teacher is performing the procedure and you're just watching. That's what medical students are doing. Okay, that's easy. And as a resident or fellow, now you are performing the procedure and you are being observed by the, you are attending. And that's what you're doing. By the end of this year, we are hoping that you can come to this stage, meaning that you are performing the procedure, and then your juniors are watching you. But you are controlling the procedure, so but this is the minimum you have to clear at the June 30th of this year, 2023. Now, once you become attending, I think you have to come to this level. I think, you have to watch as an observer, and you have to let your learner learn the procedure. This is more challenging. This is more, I think, scary. I mean, all of our attending, at least I am struggling at this level, how to make this happen smoothly. So we have to keep working on it. And so, you guys did a Vital Talk session twice, once in, I think, July or August, and then once in, I think, December. So we taught you this communication skill. So they, Vital Talk team, they claimed that we should move from old paradigm to new paradigm. What they say is the role of the teacher used to be an expert. But the new paradigm, they think that the teacher should be more like a coach rather than expert. Teaching approach, before, I do this, so you watch how I do it. What's the expert in action? But as a coach, let me set up for a successful encounter. So, the teacher make preparation and set up the stage, and then let the learners do the procedure. So that is what they say. And outcome of feedback. After that, instead of learner thinks I should have said or I should have done this or that, learner thinks next time I'm going to. What teacher knows this is the right way to do it. Rather than that, novice are different from experts and the learner is moving along developmental path. This is what they say in this paper. I personally not necessarily agree with all of this. I think we should have the component of both, maybe more emphasis on the new paradigm. But I think this watch the expert in action. I mean, depending on the learner's level, I think you have to show the right way to do that, and then let them try. I think teachers should make how to say, change the approach depending on the learner's level. I think this is a challenging part as a teacher. Of course, if as a fellow you are getting to the more become independent, then I think we should give you more autonomy. So I think we should more towards this right side column. But emphasis is more toward the right side. Okay. The novices see the world differently than experts. What your learners see, see how it is going is different than, how we see it than experts. So what is the most effective way to give feedback? So the master teacher, so when we give the feedback in the best way, they say that there are 3 steps. First is get a learning goal. Set up the goal first. And then observe the learner in action. And then assess what happened. Give the feedback. So what do you mean by get a learning goal? First, the teaching starts here. So the prompt, self-reflection and assessment. So you have to, you should facilitate, let's say, we expect a family meeting, you are attending, and then you are working with your fellow medical student. So, and then let's say you are able to let the learners lead the conversation. So maybe I think learners cannot be medical student. Learners, if it is a family meeting, it should be like resident or fellow. If this is like a phone conversation or just interview, I think we can do the medical student to do that. But I don't know. I personally not comfortable, let the medical student run the family meeting. Don't you think? What do you think, the attendings?
Yeah, I think it's tough. I have in the past, towards the end of like a month-long elective, for example, where they've observed quite a few meetings, I've had them like do the introduction piece, and then I'll take over right afterwards, just so they're getting some practice.
Yeah. I personally, when we call the family over the phone, about the not like real goals of care, but like following up after the family meeting or something, then I let the medical student lead the conversation. But like real family meeting, like making a prognostic statement, exploring goals and values, and make a recommendation, I think it's too much for the medical student. So that's how I approach. I get the feedback from medical students that I wanted to have more experience about the communication. But in the ICU family meeting, I don't think we can let the medical student run the meeting. That's my opinion.
I think there's like an intermediary step too that I think we're often doing these kind of goals of care conversations, but in a less high stakes setting, and not like a family meeting where there are 10 people sitting around a table, but perhaps on a follow-up visit and having a medical student explore some of the patient's goals, or maybe speaking with a family member to ask them a little bit about, tell me about your loved one. So I've certainly done some of that preliminary goals of care exploration, but not necessarily in a high stakes decision-making kind of meeting. Oh,
Yeah. Okay.
someone wants to participate in our Zoom meeting.
But regardless, prompt self-reflection assessment. So the teacher, you should ask, like, what is challenging in this case, what is challenging in this situation, and what are your goals? Let the learner think what should be the challenge and what are the things that you want to achieve. And formulating and working with goals. Let's say I want challenging because the patient might be upset, and then that might be challenging. So then, based on that, you try to formulate and working with goals. So how do you think you will try to do that? Any specific skills? The bottom line is the more specific, the better in terms of goal. So letting the learner choose. And then if not forthcoming, may give a suggestion. So here you also have to make adjustment based on the learner's goal, learner's level. Some learners might be very motivated and they say that I want to work on the, I want to talk about, use the we statement. I want to work on the, I want to address the emotion. I want to use nurse. Or, I want to make a recommendation based on the, after getting a lot of information about goals and values. So they could be that specific, but I think that's relatively uncommon, in my opinion. I think that especially the other non-palliative care learners, like just medical students or like residents who are rotating with us, I think they are more like broad. So then I think you give some suggestion, and then when you give suggestion, you have to think what the level of the learners. You should not give the higher task, like making a recommendation to the learner who cannot even address emotion. So if they say, I want to make a recommendation, if medical student said, I want to make a recommendation, then you can kind of, redirect them. Well, okay, so in order to give the recommendation, I think first we have to tell the prognosis in a compassionate way. So how should we do that? So that way, I think you should try to direct depending on the level. But make sure that let the learner engage. And then the more specific, the better. Rather than, okay, so let's focus on addressing emotions. That's okay, but rather than that, okay, so why don't we try to use either, the respect statement or like explore statement, something like that. That is more specific, and that's better. And especially when the learner is, the level is not so high, one goal is enough for one encounter. We tend to be, I don't know, greedy. We want to put the we want to get a lot of learning from one encounter, but generally speaking, one goal is enough. If a learner can learn something, one thing from that encounter, that's more than successful. When I work with the you fellows, I usually try to give 2 or 3 feedback, like learning points. But that's because you are palliative care fellows. But if you are working with non-palliative care, like medical student or resident or somebody, I think one goal is enough in one encounter. Then, after you set the goal, you observe the learner in action. I think, especially in communication, what is important is take notes. Because without taking notes, you cannot give specific feedback. At least I cannot remember this is what they said, and then to that how patient respond, and then this is that the learner said and patient respond. I don't think we can do that. So you have to take notes. And when you did that, you can say like this: when you said X, patient did Y. When you said that, excuse me, when you said you are dying, patient looked like overwhelmed. Patient looks shocked. So the you should try to take notes. And this is the most difficult part. Let's say in a real world bedside, like family meeting, when to intervene, because we have two obligations: obligation to a learner and also obligation to a patient. I mean, we want to make the learning. We want to maximize the learning, the opportunity effectiveness, but at the same time, we have to provide the best care possible to the patient. So we have to take this balance. And learners not aware where they are, they might be putting a lot of information. It's too overwhelming, and then it's so obvious to the to us watching that patient is not absorbing any information, but you keep talking. So in that case, when to intervene, Dr. Buck, Anthony Buck said that one way to interrupt is, attending said, could I add something here? And they interrupt. And then you take over something. Let's say when you are stuck with giving the prognostic statement, can I add something? Maybe what we should say is this, and then you take over. But after that, now we have to explore golden values. Okay, so Dr. Klein, could I ask you to talk about the next step? Then I give back to Nadav. So I think this is a sophisticated way to take over and give it back to the learner. It's very challenging. In a real family meeting, I cannot do this so well. But this is what we should aim at. And sometimes you have to take over for whatever reason. That's okay. But when you have to take over the conversation, I think feedback will be more important. If you are talking and your conversation was taken over, you might be disappointed. You might be, frustrated. So I think the teacher should be mindful about the learner's emotion. So make sure address learner's emotion. And I think it's important for the teacher to explain why it was interrupted, why it was taken over.
And also just to let the learner know that they could ask for your assistance at any time in a family meeting, so that they can maybe give you a look or some kind of signal that they're getting stuck, and rather create a bigger deal out of that. Just be like, I got stuck, and sort of look over at their attending, and the attending jumps in and says, can I add something here? And they're like, yes, please. And also to set the expectation that there may be a moment, or there may be some times when I jump in and add something just to let the learner know, so it's not an unexpected, shocking kind of disruption to the flow.
Yeah, I agree that maybe better to set the rule beforehand. Okay, if you're stuck and you look at me, then I can take over or something like that.
It's basically the same thing we do that you'll talk about shortly, when we're doing these sort of simulations with a hot seat. The same idea. This is in a real-time situation with real patients or real family members, so it's even hotter, right? It's even more, as the stakes are higher.
Right. So, and assess what happened. So in terms of feedback, be specific. That was good. You are great. I mean, this sounds nice. but it's not specific. You don't know what you are being praised for. So it's better to say, when you set X, the patient, when you use when you said, this must be difficult for you, that understand statement. When you use understand statement, I think the patient looked more calmer. I think patient emotion calm down. So that is more specific, the feedback. And also make it balanced. I think the learners are doing a lot of positive things without them noticing. So it's important to give the positive feedback. It's not good that only give negative feedback. You should give negative too. I mean, constructive feedback, but positive feedback too. I think you should reinforce what they are doing great. And focus on the behavior, not the personality. Nadav, you are so mean. This is not good. The way you said the things might be sounding mean, or I think that sounds nicer. So the don't focus on personality. And share observations. So the Nadav, you didn't do that, or you did that, or you didn't do that. Rather than that, I saw when you said that, I saw patient looked confused. So maybe the way you said was should have been softer or nicer or something. So give the objective data, not your interpretation. Okay. I saw that, or I observed the patient looked like overwhelmed. I saw patient looked confused. So that way, I think give that objective data. That's important. And make offers and suggestions. Rather than, you should have said this, you should have said that. Rather than that, I wonder if, if you phrase that way, that could have been better or something like that. I wonder if, when you offer suggestions. This one, I don't know. I think sometimes I say, you should do that. You should, I don't say you must, but should is, I think, sometimes okay, depending on the situation. But, I wonder if definitely sounds nicer. And check the learner's interpretation. So after you make some suggestion or recommendation, you check with the learners. What do you think? How does it sound to you? Do these work for you? So this column is more like soft and nicer, better way to give the feedback. Okay. And pitfalls of feedbacks, sandwich. We all know this. Positive, negative, positive. I think that's good. Good is safety. Everybody knows that. And then I think it's comfortable both on giving end and receiving end. But the downside is they're so used to it. So sometimes they're not listening to that. It's so automatic. And this positive, negative, positive, not necessarily connected to the learner's goal. Important thing is the goal, observe, and feedback. Okay, setting the goal, and then the feedback should be, connected to the goal you set in the beginning. And evaluative and non-descriptive. That's really good. You really cared for her, but how? You should mention how. And that's a very wrong way to respond to a statement like that. I mean, this sounds so harsh. Also, too many points. It could be overwhelming. And then if you give too many feedback, like 3 or 4 or 5 points for them to improve, I think the most important information is going to get blurred. So as a teacher, you might get motivated. You really want the learners to improve. So you want to give a lot of feedback, but sometimes that too many message is going to be like counterproductive. So when you give feedback, this is the way it's good, like better, how was it going? So get the learner's sense, how was it going? And then you ask for positives. What did you do well? And then you emphasize using the specific data. What patient said X, you responded with Y. You name the emotion beautifully. So reinforcement for the positives and be specific. And then you should give some constructive feedback. So is there anything you wish you had done differently? And here, this is I think challenging part for the teacher. Some learners are high level. They say like this, she was upset, but I was not sure how to respond. So they are aware of the where they stuck. In that case, you can say like, great, you picked up the emotional cue. So how can we respond to that? And then you can talk about the you can talk about constructive feedback. But not all the learners like that. Some learners like I have no idea. I was blank. I didn't know what to say. So in that case, you have to give more feedback like this. When you said X, patient said Y. What do you think that was happening? Maybe that was because she was upset. How could you respond to that? So what's happening here is first you show the data, objective data, okay? And then what do you think was happening? So still you let the learner notice. After show the data, try to let the learner come up with the learner notice that. If learner noticed that, great. But if learner didn't notice that, you still have to give. Maybe that was because she was upset. You give a suggestion, and how could you respond to that? So you see the difference between this learner and then this learner. So depending on the learner's level, you need to change the way to give the feedback. So make sense? Any questions so far? No? No questions? Okay. So now, so let's see how we do that. So we'll show you the role play. How can we utilize role play? So when you become attending, maybe depending on the situation, I think you could be in the position to facilitate the role play of the communication. So the role of role play in the communication skills, everybody hates role play, nobody likes it. This just seems unreal. So if I had a relationship with this patient, it would be different. In reality, I have to deal with other things to do. But in communication, it's safe environment. They can practice skills, and then we can give the real-time feedback. So it is effective. How can we make it more effective? So you all did the vital talk and jelly talk, hot seat role play. I think this is the most effective way to practice communication skills, in my opinion. It's anxiety provoking, but the learner in hot seat can have opportunity for the deep skill building. And then also the other learners who are just watching can, by writing down what is being said, I think they can also cultivate the communication skill. And only facilitator or hot seat learner can take time out. Observer should take notes and exact phrases and body language. Ground rules, I think, try to write down exact phrases. Feedback should be specific. Pay attention to patient's response. So role play. So we'll show you how to do that. I mean, I think it's familiar to you because you did it twice. But let's approach this from the facilitator standpoint. So this is a case. Mr. Brown, 78 years old male, hypertension, diabetes type 2, HPI. He was diagnosed with pancreas cancer 6 months ago with liver mets. It has been treated with some chemotherapy. initially doing well, but over the last 2 months, he started to lose appetite. 3 days ago, he was admitted with worsening LFTs, bilirubin is now 10. A CAT scan showed the progression of the disease with liver mets, normal chemotherapy. Now BP dropping, and then we just gave the IV bolus. He lived with the son, and he's very involved. He comes every day at the bedside. And then the son just came to the hospital requesting to talk to the primary team about CAT scan result. And you spoke with his oncologist, Dr. Lee, and he'll come back in 2 days. He asked you to give this news. I mean, it's not good to oncologist, but oncologist asking you to do that anyway, so we'll do it. So now, so Dr. Brindaman is going to play the son, and then Dr. Callahan is going to play the learners. Okay, so let me show you. So let me share the screen. Okay, so everybody turn off the camera.
And also, if you go to Zoom's the video settings, you can actually turn off where it says hide non-video participants.
Yeah.
So that way everybody kind of just disappears except Mary and myself.
And fellows, if you can, try to write down as you did like you did in the Vital Talk. Okay, so I'm gonna facilitate. So Dr. Callahan gonna play the learner, and then Dr. Brindaman is going to play the son, and then we'll show you how we give the feedback. Okay, so let's start. So Mary, so what is challenging in this case?
Well, it sounds like this is going to be some new, really serious news that I have to share.
Yeah. So any specific skill you want to practice?
I would like to practice, I think, sharing a concise headline.
Concise headline. Okay. Very good. Okay, so let's practice that. Okay, so now I brought the sun, so you can start whenever you're ready.
Hi, Mr. Brown.
Hi, how are you?
I'm Dr. Callahan. I'm one of the residents helping to take care of your dad.
Yeah, what's been going on? I've been trying to get information from the nurses and other folks here. I just came back from work and came right to the hospital and just trying to get some understanding of what's going on. It sounds like you had a CAT scan done, and nobody's really saying anything that's happening. And I'm getting nervous. I mean, I feel like I checked his labs on my chart and things don't look like they're different. I just don't know what's going on.
Yeah, and maybe it'd be helpful for you to fill me in. What is the last thing that you've heard from the doctors?
Well, I mean, Dr. Lee's been out of town, so I've been talking with his nurse practitioner. I've been trying to message them on my chart. Nobody gets back to me. But I know he's got cancer and they're treating him, and he's done okay. He doesn't tolerate the chemo very well. He's always a really tough afterwards, nausea and fatigue and everything. But we're hoping that it's working. And then he had this episode and had to come to the hospital, and so just we're all just really worried. I just want to make sure everything's okay and we can get back to the treatment cycles.
Yeah, would it be okay if I shared the results of the CT scan that we've gotten?
I mean, not if it's bad news. I don't want to hear anything bad. If it's bad news, I don't want to know it.
Mm.
I mean, I'm hoping it was just like an infection or something. Like that's what the resident was saying the other day, and I don't know.
I wish I had different news. The CT scan shows that the cancer has gotten worse.
I can't deal with this right now. I can't. I can't. That's not the news I was hoping to hear. I mean, they said it was an infection. They were giving him antibiotics. Well, are you sure? Are you sure about this? Maybe the radiologist is needs to, maybe we can go to another hospital and get a second look or something like that. I've heard the radiologists here sometimes are not, overread things or whatever.
Yeah, I mean, I think it's pretty clear based on the scans that the chemo hasn't been working.
Oh, yeah, this is going to devastate him. I mean, I don't know what to say at this point. This is like, yeah. No, this is not. I don't know what to say. I mean, is there anything else that we can do? Does this mean that he's done with chemo, or is there? I need to talk to Dr. Lee. And this is, I mean, who are you anyway? I mean, this is crazy. I mean, we've been dealing with Dr. Lee this whole time. I'm sorry, I don't need to be aggressive towards you, but it's just like, what the hell's going on here?
Yeah, well, if it's helpful for you to know, we did discuss this with Dr. Lee, and he agrees that.
Okay, let's take time out. And so let me see. So, Clay, can you turn off the camera? So how was it going, Mary?
It was okay.
It was great. I think, yeah, I mean, he was very emotional after you gave the bad news. What did you do well?
I asked him what he knew already.
Yeah, I think you did the perception very well. What else did you do well?
I think my headline was clear.
Yeah, I agree with you. I think, I also saw that before giving the bad news, you use a wish statement. I wish I had better news. And then CAT scan showed I think cancer is worse. And also after that, he showed some emotions. And then when he asked you, are you sure? You also answered with very clear headline. It's pretty clear Kim was not working. So that was very simple and that was very clear. So I think that your goal of concise headline, I think that was fantastic. So looking back, is there anything you wish you had done differently?
Well, he was getting so upset. I didn't know what to say.
Yeah, right before I timed out, he was saying that, I need to talk to Dr. Lee. It is crazy. So this is obviously the sign of emotion. And how can you respond to that?
Maybe, I mean, I guess if he was emotional, I could try using a nurse statement.
Yeah, okay, so I agree with you. It is emotion. So yeah, we should try to use some of the nurse statement. What can we use?
Maybe something like, I can't imagine how difficult this must be.
Okay, I think that's great. So let's practice that. So I'm gonna bring the Sam back, and then let's restart by him saying that I need to talk to Dr. Lee. It's crazy. Let's restart from there.
I need to talk to Dr. Lee. This is crazy. I mean, what's going on here? They tell me it's an infection, and now I'm hearing something totally different. This is not okay.
I can't imagine how difficult this must be.
Yeah, this has been such a hard time for myself, my family. It's just really hard watching my dad go through all this. Yeah.
Okay, time out. How was it, Mary?
It was good.
Yeah, I think how was it different?
He definitely seemed to kind of come down in his emotion after I responded with my statement.
Yeah, I think yeah, you named the understand statement, and then before he was like very emotional, but I mean, not all the way down, but his emotion calmed down, and then he was taking a deep sigh. I think that was a sign that your understand statement was very helpful. Great. So, what is the take home from this?
When a patient's loved one is getting emotional, to respond with a nurse statement.
Great, thank you. Okay, so big timeout. So everybody can turn on the camera. So what we just did was that first we tried to set the goal, and then I tried to ask the learners challenge, and then try to set the specific goals. And after that, we went to the conversation. I tried to take note, and when I take note, when I pick up something which is very good, I put a star because that makes it easier for me to give the feedback after afterwards. And then especially for this vital talk setting, you see if patient learners get stuck. So I took time out when the I need to talk to Dr. Lee. It's crazy, and then Lana was trying to answer with, we can try to help Dr. Lee, but that I thought that time, I think we should give some, the nurse statement, like empathic statement. So that's why I took time out. And then I tried to let the learner try a new skill. And then when I give the feedback, first I start with how was it going? And then just exhale, because this is very nervous and intensive. And after that, I started with the positive feedback. What did you do well? And then you reinforce what the positive feedback. And after that, we go to the constructive feedback. Let the learners find out where they get stuck, and then let the learner lead in terms of like a new skill like response. If they come up with, I mean, in this case, I think Mary came up with a new skill, so that was good. But if sometimes I have no idea, I get blank. In that case, you have to give some suggestion. So depending on the learner's level, I think you need to make adjustment on their own to give feedback. That way, you can maximize their learning. Okay. So let me share the screen. Okay, so okay, so this is the piece I wrote. I told you this before, that difficult communication is really a procedure, and learning its skills is surprisingly similar to learning surgical skills. And as in surgery preparation, and then you jump on the procedure, and you reflect, and then utilize that lesson to the next procedure. That's how you do, Gianna. And in communication, when you are talking before the family meeting, you should do the same thing in the preparation. So how should I explain the medical condition? How should I answer if they ask me or ask that? And then you jump on the procedure, and then you reflect, and then you utilize that lesson to the next conversation. As a teacher, it's the same. Okay, when teaching communication, you have to think, okay, so I'm gonna go to the family meeting with Nadav. So then how in Nadav's level, so what should I let him try this time? Then what part of the meeting is good for this resident? And then I let the Nadav lead the conversation. And then here you have to go through the goal, observe, and the feedback cycle. And then maybe I didn't do a good job in goal setting. Maybe I didn't do a good job in taking notes. Then I have to reflect. Should I have phrased the feedback differently? I said, oh, today I told Nadav that you should have done this. Maybe I should have said, I wonder if you should try that. So I should have phrased it nicer. So that kind of lesson, I have to utilize that for the next teaching. So, even as a teacher, you have to practice. Only practice makes perfect. The conclusion is, communication is not something trainees or are not good at doing by nature. Communication skills can be taught, learned, and practiced in a structured way. And as a learner, procedure, preparation, procedure, and review. But as a teacher, you have to go through these 3 steps: goal setting, and observe, and feedback. And teaching communication is also learning. As a teacher, you have to go through this preparation and procedure and review. Okay, this is my dog. Okay. Any question?
Yeah, I have a question, Dr. Nakagawa.
Sure.
The very first question after like a pause in the role play, or after some sort of procedure that the person is doing, the question is always, how do you think you're doing, or how do you think that went, or some version of that. And I've never heard anybody say anything other than like, I think it went okay. And like, you don't, like, as a learner, you don't want to say, oh, I think it went great when everyone thinks it sucked, or you don't want to say, I think it was terrible when there were good pieces. And so I'm just curious, like, the utility of that question, or if there's something else that might get a more helpful answer for the person who's giving feedback.
I think the purpose of that question, what do you think? How was it going? I don't necessarily agree that everybody said that it went okay. I mean, when I was a fellow, I said that it went terrible. I didn't know what I was doing. So not necessarily all time all the question. The reason why you have to ask that question, in my opinion, is that you need to, I mean, learners is like overwhelmed. So I think you need to let the learner exhale whatever feeling they are having. They might be feeling, yeah, we did a good job. They might be feeling that was okay. They might be feeling, oh, it was terrible. Whatever it is, you just let the learner exhale. I think you start by asking, what did you do well? That I think is too acute, too sudden. I think you need to give the learner to exhale whatever they are feeling. That's the point.
Yeah, I think that's absolutely right. And then you can get into how's it going. Right after how's it going, what did you do well? What do you think you did well? Or elicit that from other people who might be watching.
You also need to you also need to change your approach to the resident who thinks they are great versus who thinks that it sucked. I mean, when they say it sucked, and you want to give more like positive, like encouraging feedback. And if they say it was great, you're like, oh well. I think so. You have to change the approach. So that's why I think it's important for you to ask that how was it going. What else? Any other questions? Okay, so I think we can finish. Thank you. Thank you very much.
Thanks, everyone.